Hello, everyone. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Sorry, just breezing in from across the hall. Today is Monday, February 14th. Happy Valentine's Day, everyone. Hope that you enjoyed the big game yesterday and that you're able to spend some time with those that you love on this Valentine's holiday, Monday. I'm here just to give you a brief update of the impact of the COVID-19 pandemic on Mobile County, and then to discuss a few current events, recent updates, and also just to make a couple of announcements. So let me grab the numbers here. So yesterday, 71 cases of COVID-19 were reported to us. That brings our cumulative total to nearly 111,000. 0 additional deaths were reported yesterday, though we are seeing a slight uptick in the number of deaths reported. I think last week there were around 20 or 22 deaths reported that occurred last week. And again, a very unfortunate event. Please get vaccinated to try to protect yourself from hospitalization and death from COVID-19. We know that it still happens in some people who are vaccinated, but you have a much better chance at surviving your COVID if you've been vaccinated and boosted. So 13 additional hospitalizations were reported to us yesterday. The good news is that for the past 2 weeks or so, nearly, the number of people hospitalized with COVID on any given day has been going down. So we have been under the 200 mark, fewer than 200 people in the hospital the last 3 days with COVID-19. That is a great trend. Again, if you look at our daily report and our weekly report, the number of cases is going down dramatically. Less than 1,500 cases were reported last week. The number of hospitalization continues to go down. The number of deaths is getting slightly better. The number of people who are seeking treatment for COVID-like illness is down dramatically, and that measure that we look at, the percent positive test, is down less than 20%. So statewide, it's under 20, and Mobile, that number is around 17%. So all of those indicators going down is really good news, but remember, we're not out of the woods yet. Back in November and early December, we were seeing less than 5% of tests were positive, and 10 or 20 people were in the hospital with COVID-19. So we're still, tenfold above what we saw in November and December. So it is not too late to get vaccinated. When you are out and about, particularly if you're at an indoor setting, please wear a mask and keep your distance. And if you're in a crowded outdoor space, please do the same. Stick with groups that you know are vaccinated. That is your safest route if you're going to be enjoying the Mardi Gras festivities in Mobile. Hang out with people that you know are vaccinated. And if you are not able to do that, then please wear your mask and keep your distance from people that you don't know. I think one of the biggest, strongest, simplest messages that we have right now is stay at home if you're sick or if you've tested positive for COVID. We don't want you out in the community if you may be infectious to others. So please stay at home if you're sick, if you've tested positive, or if someone in your household has COVID. Please stay at home, skip it this year, and go to a parade next week or next year if you must. So just hoping everybody will help us keep community transmission going in the down direction. That's what we want to happen. I wanted just to say a couple things about influenza. Influenza has gone down dramatically. So influenza-like illness is at a very low rate in Mobile County. Right now, it's 1.1% of doctors' visits are for influenza-like illness. And people ask me frequently, if it's not COVID and it's not strep throat and it's not influenza, then what is it? So I just wanted to try to read to you some of the other viruses that are circulating that cause influenza-like illness. These are viruses that circulate every seasonal flu season, so are circulating, every year in the colder months. and things like adenovirus, the 4 other coronaviruses that cause the common cold, human rhinovirus or enterovirus, parainfluenza 1, 2, 3, and 4, Mycoplasma pneumoniae, human bocavirus, pericovirus, and RSV. So there are a lot of things that circulate during seasonal influenza that cause illness that looks similar to flu or COVID-like illness. So again, reasons that even if you're vaccinated, please try to cover your cough, stay at home if you're sick, stay away from others, wear your mask, distance yourself when you're out in the community. So a couple of updates. The FDA authorized a new monoclonal antibody for the treatment of COVID-19 Omicron variant. So Eli Lilly drug, bebtelovimab, I've said that like once before today. So a new monoclonal antibody put out by Eli Lilly that has been authorized for emergency use. It has retained activity against the Omicron variant. So this brings the number of treatments that are available for specifically that do treat Omicron to 4 things. The new monoclonal antibody treatment, sotrovimab, Paxlovid, and molnupiravir. So remember, sotrovimab is a monoclonal antibody product, and then also the 2 antivirals that can be taken orally, the Paxlovid and molnupiravir. So the new one is like previous monoclonal antibody products, is for the treatment of mild to moderate COVID-19 in adults and pediatric patients 12 years or older or weighing at least 40 kilograms. Patients must have positive results of a viral test, and they must be at high risk for progression to severe COVID-19 disease, including hospitalization and death. So it is to treat those that are most highly susceptible to severe illness and death. You have to be have mild to moderate illness and be within a few days of your positive test. It's a single IV injection over about 30 seconds, and then they need to watch you for an hour. So again, it has to be administered in a healthcare setting, but it is good news that there is another monoclonal antibody product. I'll practice saying that name, and maybe I can get it right next Monday. So that is good news. Then there has also been an update to CDC recommendations for vaccination for people who are moderately or severely immunocompromised. So again, if you are moderately or severely immunocompromised, there has been some clarifications to remember that we're suggesting that you get 3 doses of a messenger RNA vaccine, Pfizer or Moderna, and then get a 4th dose booster, right? So if you're moderately or severely immunocompromised, the recommendation is that you get 3 doses of an mRNA vaccine, and then you get a booster dose. The new guidance shortens the time frame for between the primary series and the booster dose from 5 months to 3 months. So again, if you're moderately or severely immunocompromised, we want you to get a 3-shot primary series, and then 3 months later, get a booster dose. Also, if you're moderately or severely immunocompromised and you got the J&J vaccine as your primary series, we want you to get a total of 3 doses. So we want you to get 2 additional mRNA vaccines. So if you got Johnson & Johnson and you're immunocompromised, please get an additional 2 doses of either Pfizer or Moderna. Remember that CDC is now recommending the mRNA vaccine, Pfizer and Moderna, over Johnson & Johnson. You can still get Johnson & Johnson if you have a good reason for doing so, but we're recommending that you get a messenger RNA vaccine. Also, there were some changes that say it's no longer necessary to delay vaccination following treatment with convalescent plasma or monoclonal antibody. It used to be that we wanted you to wait 90 days after monoclonal antibody treatment or convalescent plasma treatment, and that is no longer the case. So you can go ahead and be vaccinated following the receipt of either of those therapeutics. just reading my notes here to make sure I'm covering everything. All right. So again, if you are, talk to your doctor if you think you might be in this category of mildly or moderately to severely immunocompromised and need to talk about your dosing schedule for your COVID vaccine. We want everybody to get a primary series and a booster dose that's as soon as they're eligible so that they are what we call up to date with vaccination.
The CDC videos.
Yeah, Mark is mentioning to me that this is about testing. So let me switch gears just a second. With regard to testing, the at-home test kits that were promised by the federal government have begun showing up in people's mailboxes. I received mine. I got 2 Binax Now test kits about 2 weeks ago. Other people, coworkers that I know, people in my social circle have gotten different products. And so there is a CDC website that has a video on self-administration of those tests. So Mark has put it on Facebook, on our Facebook Live broadcast. And so you can go there, whatever product you got, go to that page, and there's a short video there that walks you through self-administration of that test. The one I got is pretty simple to use because I've been using it to test at our clinic from time to time in the last year or so. But some of them I hear are a little bit more complicated. So if you have received at-home test kits, please go to that website, keep it handy, so that when you need it, you'll be able to refresh your tutorial on collecting a swab on yourself or someone in your family member and performing that test. All right, let's see. There are a couple of questions today. Everybody wanting to know how Mardi Gras is going to impact our COVID epidemic or pandemic. So right now, as I said, things are moving in the right direction. I think that there's still a lot of COVID transmission going on out there. We don't even know about all of it, right? Because now there are lots of these at-home test kits that are in people's houses, and those are not reportable to public health. So we really are, don't have a true sense of what the extent of transmission is in the community, but we know that it's still, really high, 10 times higher positivity, 10 times higher hospitalizations than we had in November or December before the Omicron wave started. Do I think Mardi Gras is going to extend it? Yeah, the models are showing that it will take about another month before our cases and hospitalizations are back down to, double or single digits a day. That's what the models are showing, and they're usually pretty good. So I expect that we are not going to get back to, a dozen cases a day or, 15 people in the hospital and less than 5% positivity. I hope it will happen by the end of February. That would be amazing. But I will not be surprised if the decline is extended in Mobile County because of the gatherings that are happening around Mardi Gras. So again, this is the land of personal responsibility. This is the time of personal responsibility. So if you make a decision to attend a social or go to a parade or go to a ball, then please do what you can to protect yourself and your family, because we know, we've seen that, the weather's been nice. Lots of people are itching to get out and catch some beads and some moon pies. All right, let's see. Someone was asking us on Facebook mentioning that they got their first vaccine last year this time. They got their booster, maybe July, August, 6 months later. And now it's been 6 months since their booster. When is there going to be another dose for folks that got vaccinated early? And I don't know is the best I can say about that. Right now, there are not any national conversations about a second booster. It won't surprise me if it happens. But right now, I'm not hearing anything nationally about discussion around a second booster. What we have heard is there has been a delay in FDA considering a primary series for infants, for children who are 6 months to 4 years old. Last week I talked about that the FDA VRBPAC committee was supposed to meet next week, that ACIP was scheduled to meet on the 17th, but that has been delayed by, I hear, at least 2 months because the FDA wants the trials around the third dose to be complete so that they can consider that data before making a decision about a primary series authorized for children 6 months through 4 years. So we've had, I've had several parents ask me, when's it going to be ready? When's it going to be ready? Just know that FDA feeling like they needed to get more data, I think, is a good thing so that they can make the best decision that they have about authorization. But it will not happen next week or maybe even in February like we had thought. It likely will be delayed for at least 2 months. All right, let's see. Are we on a downward trend? Yes, on a downward trend, but still at a very high level of community transmission. What are the concerns about the spread of COVID around Mardi Gras? A lot of concerns. A lot of concerns. If you do go to a ball, think about ways that you can reduce your risk at those balls. Certainly, if you are immunocompromised or if you're predisposed to severe complications, please stay at home. Maybe shorten the length of time that you're at the ball. Like I said, go with people, sit at the table with people that are vaccinated. Wear your mask when you're not, actively eating or drinking. That not only protects you, protects others, and it's just a visible reminder that, hey, we still have, COVID around. So, try to make the best decisions you can for yourself and your family. And then someone asked, do I think we could be getting near the end of this? I've been joking with Dr. Eichhold, who retires on March 1st, that he has to cure COVID for the county before he leaves. So he and I have a running joke that I certainly hope that we get down to less than 5% by March. I'm holding my bets on that. I do think that we are turning the corner for the Omicron outbreak. Certainly, things are better now than they were just 2-3 weeks ago, and we're very excited about that, very happy about that. Finally, we have another therapeutic for Omicron. That's really good news. I do think that we are probably in the next, by summer, we'll be moving into what I hope will be a steady state. What that steady state looks like, I'm not really sure. It may look like flu season. It may not look like flu season. I think we're just going to have to wait and see. Of course, we still need people to get vaccinated because, with just a partially vaccinated population, we are still vulnerable to variants popping up. That's the way that variants happen as they jump human to human to human, and it goes on for months and years. We're very vulnerable to additional variants popping up. So I hope that things will look different in 2022 than they have appeared or different from the way they have been for the past 2 years. So remember, stay safe. Go ahead, Mark.
How is it safe if they're vaccinated or also getting the Omicron?
So the question is, this deals with the fact that people who have been vaccinated and boosted are still getting Omicron. And unfortunately, we never reached that level of herd immunity that could slow down transmission to a degree that we would see very few cases in people who were vaccinated. In a community like Mobile, where you have less than half the people vaccinated and a very contagious variant, it's just unfortunate that we have so much community transmission that even that people who are vaccinated are being exposed to so much virus that, the opportunities are greater, the virus is more infectious, and so that's why we're seeing people with vaccine and fully boosted, so up to date on their vaccine. That's why we're seeing them get COVID, get hospitalized, and some of them dying. The thing to remember is that 2/3 of the people in the hospital are unvaccinated. So still your vaccine, being up to date on your vaccine and the immunity that comes with that is going to hopefully keep you out of the hospital, or if you are hospitalized, help you survive that COVID illness. Yes, we have unfortunately lost some people who were vaccinated, lost them to Omicron infections, but 90% of the people who are dying are unvaccinated. So again, it is unfortunate, but we've had such a high level of community transmission, and we lacked herd immunity. We don't have a high proportion of our people vaccinated, and so those two things in combination made it incredibly hard on some folks that were fully vaccinated and still were unfortunate enough to get infected. All right, so I just was going to say, I think we're going to do another Facebook Live for the next Monday, and then the following Monday the offices will be closed to the public. So next Monday we'll have an update, and then we'll probably, who knows what will happen after that, but because our offices are closed Monday and Tuesday for Mardi Gras. So we'll talk to you next Monday. Stay safe out there, everybody. Get vaccinated, wear your mask, and keep your distance, and stay at home if you don't feel good. Thanks.